Doctors of Reddit, what is your most surprising I can't believe I need to have this conversation with an adult story? Not a doctor, but my human sexuality professor in grad school had some interesting stories. He worked a lot in very conservative Christian communities, and so a lot of times people got married with no sex education. He had one couple who couldn't get pregnant. Turns out they thought sleeping together literally meant sleeping in the same bed. Another couple was in therapy because neither one of them enjoyed sex or ever had an orgasm. After having them talk through step by step what they did in bed, he learned the guy was just sticking it in and nothing else. He told the guy to move back and forth next time and see what happened. The couple came back one more time to say thank you and didn't need any more sessions. Got placed doing a rotation in the orthopedic floor of a big hospital in a rural area of Southern California. I was doing my rounds and saw a patient out of bed and walking around the floor following a knee replacement. She had a cane in her hand that she was carrying like as a soldier would carry a rifle. I asked what she was doing and what she thought the cane was for. She replied she thought the cane was for pushing people out of her way since she's now handicapped and it wasn't to help her walk on her post-op knee. I was living in China and taught English on the side to a student whose mother was a physician. This was in 2012, just prior to the London Olympics. The mother wanted to send her daughter to London with a school group to watch the Olympics but has reservations about it. I asked why. She said she was worried that her daughter would catch AIDS from using the public toilets. Yes, doctor. I had severe asthma as a kid. I was intubated for a severe attack a few times. My parents were instructed to take better precautions in our home and went through instructions. More dusting, washing bed sheets, etc. And the big one, no smoking inside the house. So my parents agreed to all of this. Few weeks later I'm back in the hospital. A doctor recognized me and came over to talk. Then he bent over and smelled my head. I'll never forget that. I thought it was so weird. He told a nurse to sit there and not let me leave with my parents. When my parents showed up he asked point blank, "Did you not understand what I told you last time? Do you understand these attacks could be fatal? But we open windows and have stopped smoking in her room when we put her to bed. I saw a patient for a follow-up after 3 ER visits and as many days for asthma. He was from another country, so this was the first time I ever met him. His lungs sound absolutely terrible, but he swears he is taking the inhaler every 2-4 hours with no relief. This raises suspicion to me, as the same meds are working in the ER. I ask him to show me how he is using it. He holds it about a foot away from his mouth and does 2 puffs like Binica and swallows. I felt really bad. He had never received any education about his illness or medications. A mother came in with her son to discuss treating his acne. Son was about 15 years old and didn't really care about the acne, but mom did. After going over treatment options she asked if he just needed to do it to get rid of the acne. A grown woman with a child thought that by him having sex his acne would magically go away. SMH. Edit. It seems that many people think that having being a teenager equals acne. Thus having sex makes you a man and you would no longer have acne. Odd thought process emo. Also, WTF is up with the whole broken arms thing? Edit 2. RIP my inbox. Thank you for all the responses and clarification on the broken arm incest saga. I feel like I've officially become a Redditor and learned one of its darkest secrets. That having sex gets you pregnant. It was a 20-plus-year-old woman that couldn't grasp the idea that sex leads to pregnancy. She thought that in order for a man and a woman to have children, they needed to be married first and then have a baby. That sex was just an act unrelated to it. And then again, we are talking about a small rural community in the middle of ducking nowhere, Mexico. And edit. My highest rated comment. Awesome. Thank you. Also, it's amazing how common this misconception is all around the world. I don't want my baby to get a vaccine because Jenny McCarthy's book says her son got autism from the thimerosal in his MMR vaccine. Jenny McCarthy is a one-time Playboy model who wants to sell you her books. MMR is a live vaccine and does not contain thimerosal. Thimerosal contains ethyl mercury which clears from your body in 10 days, unlike methyl mercury which stays for months and actually causes damage. Measles killed 135,000 people in the world this last year. Autism has a strong genetic component. If one identical twin has it, there is a 75% chance the other will as well, with 75% of identical twins both having autism. Andrew Wakefield faked the research linking autism to MMR vaccine, lost his license to practice medicine, and made millions helping lawyers sue and selling books. He lives in a mansion in England. I went to school for 11 years. Spent 10,000 hours studying and just want to make sure your child stays healthy. Quit thinking your 5 minutes of internet research means anything. Get over yourself and vaccinate your damn baby. That coming to the ER for a pregnancy test is a very expensive way to do it. Apparently she didn't know you could buy one at the Rite Aid down the block. Seriously, don't come to the ER for a pregnancy test, cause the test results won't be the only surprise you'll be getting. Also, if you have diabetes, that you need to take your medication. No, getting fatter isn't the worst that can happen. The worst that can happen is that you'll die. That's why you're in the ER with diabetic ketoacidosis and suffering organ damage. It's why you're gonna lose your toes. Take your goddamn meds. My friend is a student doctor and is on placement at a small town doctor's office. She had a 70-ish-year-old woman come in with complaints of a small but painless growth that was visible at the back of her throat. Turns out it took her 70 years to notice her uvula. There was a nursing student I had once who laughed loudly and exclaimed, "How can you possibly get an STD in your mouth? Are the innocence of youth." Patient comes in at 2 AM for insomnia, clearly tweaking her brains out. Heart rate 200, can't sit still, bouncing off the walls. I suggest maybe easing up on the sugar, but doctor, I love sugar, K. Lady had a broken jaw. She comes in after 2 weeks with an open mandible fracture. Referred her to the hospital for immediate surgery. She never went BC. It doesn't bother her and she'll see if it gets better. That the 30+ cups of coffee he was drinking every day could possibly be the cause of his chief complaints of anxiety and insomnia. He said he was not willing to give this up or try decaf. Not a doctor, but when I was in Afghanistan, a local man came up to us on patrol with his hand wrapped in a sheet. He was in visible pain and was asking for a doctor. So we got the medic to go see him and I helped unwrap his hand and it was just ducking huge. He'd cut his hand very badly and, for whatever reason, kept it submerged in diesel for 3 days before seeking help. His hand appeared to have soaked up a load of diesel, or it was just infected to duck, but it resembled a water balloon and lightly touching it caused it to piss liquid. It was nasty. I'm not a doctor, but my mom doesn't have a good grasp on the reproductive system, so I had to be the one to explain that. 1. Getting my tubes removed did not remove my ability to get a period. 2. That we women have a urethra, a V, and an anus. Babies do not come from the urethra. This one was strange because she had me and my sister, so. 3. That when you neuter a dog, you just remove the balls, not the red rocket. 2. China Taiwan's sex ed was severely lacking, so my mom, until she was in her 20s, believed that if you sat on a seat still warm on the bus that a guy sat in before you can get pregnant. If you kissed a guy, you could get pregnant. I'm still finding out, years later, misconceptions that my poor mother has about reproduction and explaining things to her. So I'm only an EMT, but I want to weigh in here to this conversation. I had to tell a patient with severe pneumonia and the patient's family that you don't get sick, that is, catch a cold, by leaving your skin exposed. The family was vehemently debating me on the fact, claiming that I had no idea what I was talking about because I'm not a doctor. Attempting to explain to them the necessity for a foreign body to enter your system was the most preposterous thing to them. Edit. I just want to say to everyone who flooded my inbox with wonderful sentiments regarding the work of EMTs and paramedics, that appreciation makes dealing with the seemingly inexorable chorus of professionals telling us, me, otherwise much easier. Nurse here, retired after 27 years on the job. The number of American 20-somethings that don't know if they're circumcised or not is surprisingly high. When one with urinary tract infection symptoms needs to give a specimen for testing, I ask, are you circumcised? If not, I have to tell them to pull back the foreskin before peeing in the cup. The number of guys who have asked, what's that, is way too many. For the record, I can count the number who were uncircumcised on 2 hands. I'm a paramedic and recently transported an idiot who self-presented to the local hospital, who found he was having a heart attack, STEMI, and needed him sent to a bigger hospital for treatment. During my assessment I asked him how long he'd been having chest pain, on and off for 12 months. He tells me, any family history? One of the biggest indicators. Oh, yes. Dad died of a heart attack. Brother died of a heart attack. Both of them first presentation. Stone dead on the spot. No ducking about. So, you have a 12-month history of intermittent chest pain, and a family history of your closest male relatives spontaneously chucking hearties and dying, and you've never got it investigated. Furthermore, the only reason you came to the hospital tonight is because your family badgered you into it. I told him he needed a solid kick in the ass. To his credit, he agreed. As a veterinarian, I had a 10-minute conversation with an owner explaining which side was the dog's left side. My mother helps the Amish get dental care. One Amish woman complained that she needed new dentures. When asked why she thought so, she replied, "Well, I've lost weight. And you know that when you lose weight, you lose it in your gums first. Doctors and dentists, if you're looking for a community to serve, the Amish can truly use your help. I could write a book about the things I've seen." So, not a doctor but I work at a hospital. We had someone come into und because they needed their nails redoing. They genuinely thought it was a good idea to go to accident and emergency to have their fake nails taken off and redone because they had gotten too long and become uncomfortable. Had a patient in our high priority area for DKA. Sugar was in the 800s. Stomach pain, nausea, vomiting and the such. Pulled Burger King and gummy worms out of his backpack and proceeded to eat them. Like, bro, do you even know what diabetes is? Non-compliance and lack of medical knowledge is a big thing in Detroit. I'm not a doctor but I suppose this is related. My mother, before she had kids, grew up not even knowing that you could breastfeed a baby. She was never told anything about what breasts were for, sex and even about homosexuality. Her parents never talked about any topic that was considered taboo. My mother learnt about that once she had her first baby subsequently at 16. I had to explain to a grown man I still work with that tampons don't break down in a woman's urine after they were finished using them. He's been married 12 years. It was not his best day. Obligatory not me but my wife. She's a nurse practitioner and had to explain to a 40-year-old man that brown sugar did, in fact, contain sugar and that is most likely the reason why he now has diabetes. The same man also adamantly insisted his wine consumption was not an issue because he only drank the dry stuff like Chianti so it doesn't have any sugar. Well, it looks like she is about 30 days pregnant. Congrats. How can she be pregnant? She is only around her brother. Well, actually they don't follow the same moral code as you or I. Veterinarian. My brother is a general practitioner in rural Tennessee. Enough said. Right? He says most of his patient visits go about like this. MD, well, person, you're pre-diabetic, have high blood pressure, and are complaining about joint pain. Have you been exercising and cutting out sugar and carbs? Person, yeah, I have. Doc, but it doesn't seem to help. Do you have any better meds you could prescribe? MD, well, let's talk about your diet. How much water do you drink a day? Person, I don't like water, so I get extra ice in my sweet tea every day to make sure I get enough water. MD explains how that's not enough water by a long shot. How much sweet tea are you drinking every day? Those can have a lot of sugar in them. Person, well, I get a large one from Hardee's, McDonald's wherever on my way to work with my breakfast, and another one on my way home for dinner. Then I have a glass or two when I get home. MD, well, that's a lot of sugar, and a lot of fast food if you are eating it twice a day. What do you eat at home? Person, I don't like to cook so I usually don't eat anything but Little Debbie snack cakes at home. MD, those have a lot of sugar too. Person, I thought that all I had to do was cut out Mountain Dew. Now you're saying I can't eat my food or my snacks? What are you suggesting I do? Eat salads for every meal? Why can't you just up my meds? My mother is a doctor. She once told me this story about a patient she had. She serves low-income people. So typically immigrants, minorities, usually without health insurance. The man is from Central America and is there for a normal checkup, typical of most patients. He has fairly high blood pressure. However, this man is also having bowel problems. So my mother asks, what color and consistency is your feces when you need to use the bathroom? The man has no idea what she's talking about. My mom tries again, your poop. What color and or consistency is it typically? The man still has no clue what she's saying. He understands a bit of English. She tries again, your doo-doo. Nothing. Your fecal matter. Nothing. Your poo. Nothing. Not number 1, but number 2. Nothing. Finally she asks, it's not liquid when it comes out, but it's more solid. You know? The man has an epiphany. OHH. You mean it? He says. Yes, you're it. So my highly educated, professional mother has to continue the rest of the checkup asking about is it? What color is your it? Is it more wet? Does it hurt when you take a it? This went on for a fair amount of time. My mom nearly burst out laughing by the end of it. Absolutely amazing what a minor language barrier can do. Dentist here. Things I've had to explain to parents. 1. Breast milk can cause cavities. 2. Don't put your kids to bed with a bottle with Coke in it. They then switch to Diet Coke. Fasipum. 3. Don't wiggle out your permanent teeth just because the tooth fairy will give you money. 4. You can't brush cavities away with toothpaste or any of these new internet fads. Oil pulling. Honey. Chocolate. Once your cavity is deep enough it needs to be fixed by a dentist. 5. Fluoride isn't poison any more than table salt is poison. Small quantities are good for you. Anyone who tells you otherwise has been lied to and believe it. I have plenty more, but I'd have to think harder. Reddit had a few questions about number 3. There was a little guy probably 8 years old or so that had wiggled out his 4 lower permanent incisors, front teeth, after wiggling out his 4 baby teeth in the corresponding spots because his family made such a big deal about giving him money from the tooth fairy. They were in my office asking when the new teeth would be coming in. Had to tell them never. Edit number 2. Incisors only have 1 root typically and when it first erupts it is not completely developed and the tooth is still moving through bones so it isn't really firm in place yet. This kid capitalized on a single rooted, undeveloped, erupting tooth, and with a little elbow grease and the promise of riches was able to tough it out. Patient made an appointment and brought in his it in a box. He was concerned about the size of his turd, and if it's normal. All he got from the visit was, normal turd. Yes, it's pretty wide. Turd box was set out with biohazard waste. Waste guy thought it was a misplaced package and put it on the front desk. Secretary got quite the surprise that day. I'm a dental hygienist and once was telling a patient after a cleaning that she had gingivitis. She replies with I must have caught it from my boyfriend. Had to explain to her that it's because she doesn't brush floss enough. She was 36. A 32-year-old grown man asked me if the hot spells he was experiencing at night meant he was going through menopause. That taking that weird plant they bought from a pharmacy online isn't 14.324 times better than chemo and doesn't only attack cancer cells because it likes the acid environment in it. Paramedic here. Was driving with my partner and patient in the back. Patient was fine. Patient's skeezy boyfriend was riding in the front with me and apparently saw a golden opportunity to ask a question that had obviously been on his mind for some time. Him. So when cats and dogs eat grass, that means they have cancer, right? Me. No. No it does not. Made for an awkwardly silent ride the rest of the way. My dad's answer, I am not a doctor. My dad had to tell a patient that they were not pregnant. The patient was male. Not a doctor, but I regularly have people come in for eye examinations because when I take my glasses of things are blurry. Often these aren't passing comments during the exam, but the main reason for their visit to the clinic. My sister, who is a new Redditor and hope sees this, is a doctor and 25 years ago when she had her very first patient out of residency and this patient refused to allow her to see her breasts, which were sore and needed a mammogram to check out a lump. So sister asks why and this girl who is about 30 and single said matter of factly oh, that's lesbian. We can't do that. It's against the Lord's wishes. She loves telling this story at the dinner table on family gatherings, especially to our religious side. I don't know how much of this is true. It was my cousin, who is a doctor, who told me. He was in his first year in a clinic and people went there to have an appointment because he was good looking. Elder ladies loved him particularly. But this is totally unrelated. And the worst case was when this elder lady goes in with her granddaughter, around 8 years. She had a severely infected wound in her head. Upon close inspection, he saw the wound crawling with small maggots and the smell was terrible. He was pissed, of course, and asked why didn't she wash the wound and brought her earlier. She said she thought it would heal with time and was afraid to wash it, lest water enters her brain and kills her. There was also this woman that took her 6-year daughter there to check why she still didn't have pubes. Not a doctor, but a nursing student. I was checking the car seat and walking a postpartum mom out of the hospital. Mind you, this was her 5th child. 5. She had raised 4 other children to adolescence. But for this one, on the way outside, she took a blanket and tucked it around the baby's head and face, nice and taut. Not a doctor, but I agreed to pick up my good friend's wife from her pregnancy sonogram. Driving home, the wife tells me she's surprised it's a girl because the last kid was a girl and it's supposed to go boy girl boy girl, right? This one is a little different. My dad is a pediatrician. He told me the story of a teenage boy, around 13 years old, who was referred to him, something unrelated, can't remember what, when he asked him if he was on medications. The boy's mom pulled out some birth control pills. Apparently his family physician suggested birth control as a way to treat his acne. Yes, you read that correctly. Licensed doctor told a teenage boy that was just going through puberty to take female hormones as acne treatment. I think he had been taking them regularly for the past year. My dad told me about an extremely religious male patient who was concerned about his nocturnal emissions. He saw it as an offense to God and wanted to know what he could do to stop it. My dad's response, well, it's gotta go somewhere guy. My uncle told about a patient who thought he had Ebola because he was in the same as a coughing black guy. Had to explain to an adult you have to brush all the sides of a teeth. Like, no, just the side that shows when you smile is not enough. And yes, flossing is not just a thing for rich people. Doctor here. I think the most frustrating I've seen since I was a resident was a very pretty, like stunningly pretty, 17-year-old with what appeared to be normal, loving, affluent parents. She had a tumor in her pelvis, rhabdomyosarcoma, that we could resect to potentially cure her. The parents declined. Also declined chemo and said they want to try holistic medicine because that made more sense to them. I last saw her 3 years ago. She was getting huge lymph nodes removed from her groin because they were unsightly, obviously metastatic disease. Parents did not want primary tumor removed and again declined chemo. I see 100 patients a week probably. Lots of devastatingly sad cases. But I still think about that girl, listening to her parents, costing her life. I bet she's dead now. I can assure people, doctors are not trying to swindle you, give you unnecessary care, or have some ulterior motive in this sort of setting. 99.99% of doctors are treating patients the same way they'd treat family. So try not to be dense. We want to help.